Hey GP learners, so I'm here live at the Accurx Connect conference here with Jacob and Katie, and we're just talking about their amazing partnership they've just announced a couple of hours ago in terms of Tandem and Accurx working together to bring AI Scribe. I believe it's the largest AI something in primary care ever.
Biggest deployment in the NHS. Maybe soon worldwide, but we don't know how to measure that.
Yes, definitely in Europe, but not sure about.
Wow.
Yes.
So could you just give us a brief headline of what you've announced? I know it's on the channel and stuff, but people may not have seen that. So what exactly is this partnership between Accurx and Tandem?
So Accurx Scribe, which is powered by Tandem, will let frontline staff transcribe and then summarise the consultation. It will let them save that to the record, code that into the record, and then very soon also not just draft the follow-up communication, but one click to send that, whether that's to a patient or whether that's another professional in the system.
Absolutely, and having seen the demos, it looks impressive. There's some really cool features in that. I guess with coming towards this partnership, can you give us any details as to how this came about? I mean, this is significant for primary care, isn't it?
Yeah.
So we knew we wanted to bring out a scribe to general practice. We knew, in a time like now, more than ever, the frontline needs more ways to be productive, save them time. And so we looked at the market, we met with the whole range of the other providers. And when we met Tandem, when we saw the product, but we also understood how they make sure it's really high quality, how they make sure it scales really well, how they make sure it's reliable. We were very, very impressed. And so the last couple of months have been spent building the integrations so that the two work really seamlessly together.
Awesome. So a little bit of nuts and bolts, if we can, about the whole partnership and stuff. So I believe the rollout's going to be iterative. Some people who are lucky enough to attend this conference are going to get access from tomorrow, I hear.
Yeah, that's right.
And then further rollout towards the middle of summer, if I'm right?
Yeah, so beginning of June, all of general practice, you'll get a microphone on the toolbar and you can start using it.
Awesome. And I believe you're also giving free microphones to people who attended the conference, so I'm afraid all of you out there may be missing out, and yes, I do have one. But I guess in terms of what it looks like, one of the things I know that's coming through massively is this whole question about data security, governance. I've talked about loads on the channel, so have various others. Can you give us an idea of what that looks like for practices when they start to use this tool? What steps are they going to have to go through in terms of making sure it's safe and appropriate to use?
Yeah, of course. So obviously we've done a lot of work on this at Tandem already. So we've rolled out across, I think it's more than 30 ICBs now. So figured out how to do that. We've been working very closely with the Accurx clinical team and compliance team as well to ensure that new documentation is up to date. So the DCB documentation, the DPIAs, the DPAs, etc. As you click on the microphone when you have access to the Accurx Scribe powered by Tandem, there will be a DPA, and then we will support with the documentation that's needed to sign off across different regions as well. So any questions, please reach out to the teams directly and we can guide you through exactly what's needed to safely deploy across your practice.
Awesome. And I know that as of a couple of days ago, we had some more guidance that came out from NHS England about the use of ambient voice scribes in general practice and things. One of it mentions about practice having a CSO. So is that something that each practice from your perspective will need to have, or is that something that could be done in a different way? Keen to know what you guys think on that.
We have multiple CSOs within Accurx, and at Tandem we have an external team. So it's something we can certainly support on, and we would look at that practice by practice, obviously in line with the NHS guidelines.
Awesome. I guess another question we had is how this is going to work with phone systems. Obviously, a lot of practices have cloud-based telephony. I know there's the other announcement about Accurx Mobile that's coming through as well. So what do you see that looking like for practices who want to use the tool?
Yeah, so this will work with in-person consultations, also telephone consultations. If you're lucky enough to be using us the next few weeks while that exact integration is going through, you might have to just put the phone on your desk on speakerphone, but then soon you'll be able to, if you're using a soft phone in your computer, capture that. And then we're also looking at how do we capture, if you're using a physical phone on the desk, also to do that VoIP capture. But doing it on speakerphone works well for now. And Scribe also works really, really well for phone call because all of the communication is said out loud.
Yeah. Definitely. And I guess, where do you see potential challenges for practices who may want to, anything you've got so far from some of the case examples, I guess things to know about for practices Any tips there?
Challenges. To be honest, I thought it would be far more challenging for practices than it has been, which I guess is a good scenario. What we aim to do with practices is set them up for success. So if they want patient leaflets or things in their surgery to inform patients, we can do that. We can do onboarding sessions with staff to really help them understand the software if they needed more of that as well. But to be honest, we thought more patients would be more cautious of this technology, etc. But it's actually, we're not seeing those challenges. The biggest ones have been if there's been, people needing help with compliance documents, which often GPs are so pushed for time. But again, we're here to help with that process as well. So that's kind of what we've been seeing. Yeah,
I think the other one, and we see this broader than just with Scribe, there is just a challenge with new technology around bravery, and particularly when you're time poor and don't have much headspace to think about, or even get the chance to try new things. Just carving out 20 minutes to have a play, do some mock consultations, do that with some colleagues, do that in a practice meeting. Where we find, where practices do that, actually it's very, very straightforward. The big challenge is, finding the time and just prioritising that. But the practices have done it, have, within that afternoon session have seen the benefits.
Absolutely. And I know for me, the technology is amazing. I've been a big advocate, many people know, but as long as it's used safely, it's really encouraging to hear that the team here are trying to prioritise that safety use as well to make sure that people can use it effectively. I guess a quick question before we finish off then, it's the biggest one that keeps coming up. Cost. What do you think it's going to cost in terms of practices using this tool?
So we've got tier pricing depending on if the practice, PCN, Federation, ICB is buying it. Obviously, we really want both Accurx and Tandem, but then also general practice want there to be central funding, and so we're hoping there'll be a good push towards the centre. And the centre is, talking about the analog to digital shift. And in terms of that, get in touch with our partnerships team, and we can let you know what that is for either your ICB or for your practice. It'll be on a per patient per year licence.
Okay. So I know that with the government announcement about the use of ambient voice technology and stuff, there's this question many people are putting that actually this technology could have compound gains in terms of patient care. So it should be provided free, but I believe you guys are already doing that for some period of time. Is that correct?
Yeah, absolutely. There's a 3-month complimentary period of rollouts happening at the moment for people who sign up in June as well.
And the other thing I'd add is there never used to be funding for online consultations, there never used to be funding for messaging, and what general practice has been great at, and the reason it's adopted technology faster than the rest of the NHS, is finding that something that works, starting to use it, and then making that case clear to policymakers, like here is something the health system should be investing in, it's got a clear ROI, and we hope the same is going to happen with Scribe, like really clear productivity gains. It's exactly what the system needs at the moment. So do also send that pressure upwards as well.
Definitely.
Hey GP learners, so at this point I did ask Jacob and Katie about the pricing for Accurx Scribe powered by Tandem. Unfortunately, because of business rules and stuff, they can't explain that on the camera, and I'm not able to share that with you at this point. But what I can say is that the pricing model will be based on a per population basis rather than on a user basis. So that is information that I think is important for you to have. The actual pricing, you will have to get in contact with the ICB to get that information. Let's get back to the video, shall we?
The microphones, are they included or not?
The microphones aren't included. We will offer a route where practices can order those, but also you'll be able to use Accurx Mobile, which your phone's got brilliant ambient microphone. Start scribing on your phone and then continue editing and saving to your computer.
Awesome. So if you guys want to check out more information about the Tandem and Accurx partnership, then definitely check out this content that's probably coming up right now, which was the actual live demo that we've got. I know they're going to have loads of other tools available for you to have a look at, so definitely check those out as well. And additionally, if you want to know how to use the Scribe AI tool, then check out this video as well. We'll catch you in the next episode.